I'm Dr. Richard Brownlee. I'm a neurosurgeon at the Welcome Back MRI and Pain Management Center in Kamloops, British Columbia. I'm doing this talk today in our open upright MRI machine. And I'm going to talk today about facet joint syndrome. So most people probably don't know what facet joint syndrome is. Most people probably don't even know what a facet joint is, so I'm going to tell you what it is. This is a model of a spine. So the spine consists in the front of vertebrae and discs. Discs are shock absorbers between the bones in the front of the spine. And there's 24 vertebrae and 23 discs in your spine. At the back of the spine, we have these little bones that stick out called spinous processes, and that's where all the muscles in your spine attach. So this is the back of your spine. And at each level between the vertebrae, we have a little joint where all the movement in the spine occurs. These are called zygapophyseal joints, or short form is facet joints. So this is a different model that's just easier to show. So these are the facet joints in the spine. These facet joints are similar to knees and hips. It's where most of the movement in the spine occurs. And because of that, these joints can wear out. People can develop osteoarthritis in these little joints. They can also sustain injuries to these joints, usually by hyperextension type of mechanisms. Whiplash injuries are a good example. People get neck pain that can become chronic and can be associated with headaches, and it's often due to damage of these little facet joints in the neck. In the lower back, they're probably the most common source of low back pain because of the development of osteoarthritis. So these joints have a component that comes from two different vertebrae. The lining of the joint contains cartilage, just like in knees and hips and shoulders, and that cartilage can wear out and then the joints can become painful. So that's what facet joint syndrome is. It just refers to pain coming from facet joints. Treatment of facet joint pain basically comes down to trying to take away the nerve supply to the joints. People do fusions of the spine for chronic back pain, but it's a big procedure and it's not that effective. There's a minor procedure called facet joint rhizotomies that involves putting needles in and cauterizing the nerves to these individual joints, and that's quite effective for getting rid of facet joint pain. And we can diagnose facet joint pain by doing what are called medial branch blocks. Each of these little joints have two nerves that go to them called the medial branch nerves. And if you do injections of local anesthetic under X-ray guidance, you can freeze those little nerves and determine if your pain is coming from a facet joint and which joint it's coming from. Sometimes, if the joint's fairly healthy, you can do cortisone shots, which gets rid of inflammation, at least temporarily. So some people will get relief of their back pain from cortisone injections. Doing facet joint rhizotomies involves putting needles in, passing an electric current that cauterizes the nerves to the joint, and that can relieve back pain often for a year or more. And if the pain comes back, the procedure can be repeated. Again, there's no joint replacements at the moment for facet joints. Doing fusions is a big procedure that won't necessarily get rid of the pain and is associated with complications. Facet joint rhizotomies are a very minor, minimally invasive procedure that's very effective for getting rid of chronic back pain. So if you have chronic back pain and somebody tells you that there's nothing you can do about it, exercise is obviously important. Anti-inflammatory medication can help. But if those things don't work, then find somebody who can do facet joint blocks and potentially facet joint rhizotomies, and you can probably get treatment for your chronic back pain. If you want more information about sacroiliac joint pain or facet joint pain, you can go to our website. There's a number of videos that describe what facet joint syndrome is, what sacroiliac joint syndrome is, and the videos explain how these blocks are performed and how rhizotomies are performed. They're very informative and they're quite short. I think you'd enjoy them. So if you want more information, just go to the website for the Welcome Back MRI Center in Kamloops.